dizzy right now. I almost feel like my heart's beating out of my chest.
Oh, okay. Are you having any difficulty breathing?
Yeah, I am, and I just feel so weird.
Okay. Let me get a set of vitals on you and we'll get an EKG reading. See what's
Awesome.
going on. Ms. Santo, I have the results of your EKG test. It shows that you have paroxysmal supraventricular tachycardia. This is also known as PSVT. With a normal heart, we see about 60 to 100 beats per minute.
Oh.
With this, your heart rate is increased to between 130 to 230 beats per minute.
Is that life-threatening?
This is not a life-threatening condition if it's treated properly. PSVT refers to periods of a really rapid heart rate. This happens because the electricity in the heart isn't traveling down its normal conduction pathway. This is why PSVT is often called a shortcut arrhythmia, because the electricity is taking a shortcut to where it needs to go.
Oh, I see.
Paroxysmal means that it only happens from time to time. Patients often say that they feel like they're having a panic attack when they're going through an episode of PSVT.
You're right. I do feel like I'm having a panic attack when I'm having an episode. Why do you think this happened?
There are multiple reasons that a patient can go into PSVT. Many underlying conditions such as thyroid, lung, or heart disease, as well as recreational drug use and stress can cause a person to go into this.
I literally have so much stress going on in my life right now. What do we do to fix this?
That's a great question. So I already contacted your provider and he ordered 6 milligrams of adenosine to be given now.
What's adenosine?
Adenosine is an antiarrhythmic. It's going to briefly stop your heart for a few seconds. Don't let this scare you.
Okay.
I'm going to be with you the whole time, and you'll only feel funny for a few seconds.
Okay.
Miss Santo, I have the adenosine for you. Can I just have your name and date of birth?
Alyssa Santo, 3998.
Great. Before I give this, do you have a history of asthma?
No, I don't.
Okay, great. So I just want to remind you that you will feel funny for a few seconds, but it will subside very quickly afterwards.
Okay.
And I'll be with you the whole time.
All right. Sounds good.
All right. So I'm just going to give it through your IV here.
Okay.
I'm going to flush it first. How are you feeling?
I didn't like that feeling. I feel better now though. I do feel better now, but I didn't like that. That was weird. Toronto, can you tell me how you're feeling today?
I feel so much better than I did before you gave me that medication.
Okay.
I don't feel as dizzy and uncomfortable as I did before.
That's good to hear. Can you tell me how you felt shortly after I gave you the medication?
At first, I felt so horrible, like my heart just stopped working. But like you said, shortly after, I did feel better.
Good. That is a common side effect of this medication along with other side effects. I would say 2 common side effects would be flushing of the face and abdominal pain. More severe side effects would typically be chest pain, shortness of breath, any tightness. Sometimes patients say they feel like they have an elephant weighing on their chest. So those are some signs and symptoms that you do want to report to your provider.
Oh, okay.
Did you feel any of these symptoms after I gave you the medication?
I did feel like some tingling in my legs and arms, but like I said, it went away after a few seconds.
Good to hear. Also, there can also be a lot of interactions with this medication. For example, caffeine can be a huge one. Are you a coffee drinker?
I am the biggest coffee drinker.
So unlike caffeine, there are some drugs that can actually enhance the effects of this medication. So for example, carbamazepine, which is an anticonvulsant that we give to patients who are experiencing seizures, can enhance the effect of adenosine. Digoxin is another medication, as well as nicotine. So we always tell our patients, try to avoid any of these drugs before we give adenosine because it can enhance the effect.
So why did you give this medication to me so fast? It seems like all my other medications are given much slower.
So the thing with adenosine, it has a very rapid onset. So when we administer it, we try to push it as fast as we can so we don't lose any of that medication on the way in and we get the maximum therapeutic effect that we want for our patient.
That makes a lot of sense. So, why did you ask me if I had asthma before you gave it to me?
Another great question. So adenosine is often referred to as a potent bronchoconstrictor. In a patient with asthma, their bronchioles in their lungs are really, really constricted and almost have the diameter of a pencil. Adenosine can constrict that even more because the surrounding muscle gets tighter and tighter, making it more difficult to breathe.
Oh, okay, I understand. I also wanted to ask, me and my husband are looking to get pregnant within the next year or so. Can adenosine be a risk to my child?
Well, thank you for asking. Adenosine is actually a pregnancy 2B category, so this means that it doesn't cause any death to the fetus or any type of malformation to the fetus, so taking adenosine is okay during pregnancy.
Oh, thank God.
Awesome.
So, in my part of the scene, I taught the patient about what PSVT was, the pathophysiology behind it, and I also taught her about adenosine and how it was going to feel when it was administered.
And in my scene, I educated the patient on the signs and symptoms of adenosine, common side effects, and effects that need to be reported to the provider. I also talked about what category adenosine is in and also about drug interactions with adenosine.
Thank you for watching.
Thank you so much for watching and enjoy the bloopers.
Hi, Miss Santo. I just obtained the results of your EKG strip.
Alyssa!
We would want it to be between 60 and 100 beats per minute.
Damn
Ways
it!
that a patient.
Really?
Just keep going.
There are multiple ways that a patient can go into PSVT. Many underlying conditions. There are many reasons that a patient can go. Multiple reasons that a patient can go into PSVT. Many underlying conditions, such as thyroid, lung, or heart disease, as well as recreational drug use and stress. Why'd you make that note? Not feeling at all. But after
Wait, I shouldn't have this.